What I'm about to explain today may surprise a lot of people watching this video, because one of the most common reasons adults over 50 suddenly begin feeling weak, dizzy, mentally foggy, exhausted, or emotionally off is not always aging itself, and it's not always stress. Sometimes it's something far quieter, a deficiency that develops slowly, silently, over years, while the body gradually loses the ability to function normally. The frightening part is that many people live with it for a very long time without realizing what's actually happening. They blame age, they blame poor sleep, they blame anxiety, they blame getting older. Meanwhile, the nervous system, the muscles, the brain, the balance system, and even energy production inside the body may already be struggling underneath the surface. And honestly, this is one of the most overlooked health problems I see in older adults, because the symptoms often appear so ordinary at first. A little more fatigue, more dizziness when standing up, numbness in the feet, trouble concentrating, walking slower, forgetting small things, feeling unusually weak after simple activities, and almost nobody immediately thinks, this could be a vitamin deficiency. But today, we need to talk about it, because one specific deficiency has become incredibly common in adults over 50, and in some people, it can quietly affect the nervous system, blood cells, energy production, memory, balance, and overall quality of life long before it's finally discovered. And once you understand why it happens, you may start looking at your own symptoms, or someone else's, very differently. My name is Dr. Adam Scott Levin, and for more than 15 years, I've worked with adults dealing with aging-related health changes, metabolic disorders, nervous system dysfunction, chronic fatigue, inflammation, and nutritional deficiencies that are often missed until symptoms become much more advanced. And today, I want to walk you through one of the most underestimated deficiencies affecting older adults: Vitamin B12 deficiency. We're going to talk about why it becomes more common after 50, why the symptoms are so easy to misunderstand, what warning signs deserve more attention, and why so many people continue suffering for years without realizing what's happening inside their body. Because this conversation is not about fear, it's about awareness. And honestly, awareness may be one of the most powerful forms of prevention we have. Before we go deeper, I want to ask you something. How old are you? And have you ever gone through a period where you constantly felt tired, dizzy, weak, mentally foggy, or emotionally drained, but nobody could fully explain why? Drop your age and experience in the comments below, because these conversations help far more people than most realize. A lot of adults watching this channel discover they are not alone for the first time through these discussions. Now, let's begin with one of the biggest misunderstandings about vitamin B12 deficiency. Most people assume vitamin deficiencies show up dramatically: severe illness, extreme malnutrition, something obvious. But vitamin B12 deficiency often develops slowly and quietly over time. And that's exactly what makes it dangerous. Vitamin B12 plays a critical role in several major systems inside the body. It helps support healthy nerve function. It's involved in red blood cell production. It helps the brain and nervous system communicate properly. It supports DNA synthesis and cellular energy production. So when levels begin dropping over long periods of time, symptoms can start appearing in many different ways simultaneously. And because those symptoms often overlap with normal aging, stress, poor sleep, anxiety, or other chronic conditions, many people never connect the dots. I remember one patient in her late 60s who came into clinic convinced something was seriously wrong neurologically. She described overwhelming fatigue, dizziness while walking, tingling sensations in her feet, trouble concentrating, and increasing forgetfulness. She told me, "I feel like I'm slowly fading." And honestly, you could see the fear in her face. She thought she might be developing dementia. But after proper evaluation and lab testing, we discovered her vitamin B12 levels were severely low. The nervous system had been struggling quietly for quite some time. Now, this is important. Not every memory problem is caused by B12 deficiency. Not every episode of fatigue means something nutritional. But vitamin B12 deficiency absolutely can create symptoms that deeply affect how people think, feel, move, and function. And after 50, the risk becomes much more common than most people realize. Now, here's where things become especially important. Many older adults are not actually deficient because they eat badly. Sometimes the problem is absorption. As we age, the stomach often produces less acid, and stomach acid plays a major role in helping release vitamin B12 from food. Certain medications can also interfere with absorption over time. Acid-reducing medications, some diabetes medications, digestive disorders, gastrointestinal surgeries, chronic inflammation involving the digestive tract. All of these things can affect how the body absorbs B12 properly. So you can actually be eating foods that contain B12 while your body still struggles to utilize it effectively. And this is one reason why so many adults over 50 develop deficiency slowly without realizing it. Now let's talk about the symptoms more carefully, because this is where people often miss the warning signs. Fatigue is probably the most common complaint, but this is not always normal tiredness. People often describe it differently: heavy exhaustion, low stamina, feeling drained after simple activities, needing more recovery time, feeling physically weak even after sleeping. And because modern life already leaves so many adults exhausted, the symptom gets dismissed very easily. Then, the neurological symptoms may begin appearing: tingling in the hands or feet, burning sensations, balance problems, dizziness, numbness, walking instability, muscle weakness, and sometimes people begin feeling emotionally different too: irritable, depressed, mentally foggy, emotionally flat, anxious, disconnected. This happens because the nervous system itself can become affected. And honestly, this is why vitamin B12 deficiency can sometimes imitate other conditions so convincingly. I remember one man in his early 70s who spent nearly a year believing his symptoms were simply old age. He stopped walking as much because his legs felt weak and unstable. He became less social because he constantly felt exhausted. His family noticed he was becoming more forgetful, but he kept saying, "I'm just getting older." Eventually, testing revealed significant vitamin B12 deficiency along with anemia. And what shocked him most was not the diagnosis itself. It was realizing how many of his symptoms had slowly become normal in his mind over time. That happens more often than people think. The body adapts gradually. Symptoms creep in slowly. People adjust their lifestyle around the fatigue instead of questioning why the fatigue exists. Now, let's talk about anemia for a moment, because this is another major piece of the puzzle. Vitamin B12 helps produce healthy red blood cells. When deficiency becomes more severe, the body may struggle to carry oxygen efficiently throughout tissues. That can contribute to fatigue, shortness of breath, paleness, weakness, lightheadedness, and reduced physical endurance. And again, many adults simply assume, I'm slowing down because of age. But sometimes the body is signaling something deeper. Now here's something even more important. Long-term severe B12 deficiency can sometimes affect the nervous system in ways that become harder to reverse if ignored for too long. That's one reason awareness matters. Early recognition matters. Because in some individuals, prolonged deficiency may contribute to worsening nerve dysfunction, gait instability, cognitive changes, or coordination problems over time. And this is exactly why doctors try to evaluate persistent unexplained fatigue, numbness, dizziness, memory changes, or weakness carefully, especially in older adults. Now, I want to say something very clearly here because balance matters. Not every symptom means you have vitamin B12 deficiency, and nobody watching this video should self-diagnose based on symptoms alone. Fatigue and dizziness can come from many different causes: heart conditions, sleep disorders, medication side effects, dehydration, thyroid problems, neurological disorders, stress, anxiety, blood sugar instability, inflammation. There are many possibilities, but vitamin B12 deficiency is one of the conditions that deserves consideration because it's so commonly overlooked, especially after age 50. Now let's discuss food sources because there's a lot of confusion online about this. Vitamin B12 is found primarily in animal-based foods: fish, meat, eggs, dairy products, and certain fortified foods. Some adults following strict vegan diets may also become more vulnerable if supplementation is not addressed appropriately. But again, for many older adults, the problem is not always intake alone. Absorption matters enormously. And that's why proper medical evaluation becomes important when symptoms persist. Doctors may evaluate vitamin B12 blood levels, blood counts, methylmalonic acid levels, homocysteine, neurological symptoms, digestive history, and medication use to better understand the full picture. Now let's talk about one of the biggest emotional traps people fall into: normalization. This happens constantly in aging adults. People normalize exhaustion, normalize weakness, normalize brain fog, normalize dizziness, normalize declining energy, normalize feeling not themselves. And while some changes absolutely occur with aging, persistent symptoms should never simply be ignored without discussion. That doesn't mean panic. It means awareness. There's a very big difference, and honestly, this may be one of the most important messages in today's video. The healthiest older adults are usually not the people obsessively searching for disease every day, but they're also not the people ignoring every symptom for years either. They pay attention calmly. They seek evaluation when something feels persistently wrong, and they understand that the body often whispers before it screams. Now let's discuss something else that surprises many people: the connection between vitamin B12 deficiency and balance problems. The nervous system helps coordinate movement, sensation, and spatial awareness. When nerve signaling becomes impaired, people may begin feeling less stable while walking. Some describe feeling off balance. Others say they feel disconnected from the floor beneath them. And in older adults, that matters enormously because balance problems increase fall risk. Falls become one of the major causes of injury and hospitalization in aging populations. So seemingly small neurological symptoms deserve more attention than many people realize. Now here's something encouraging. When vitamin B12 deficiency is identified appropriately and treated under medical guidance, many people experience meaningful improvement in energy, neurological symptoms, and overall function, especially when caught earlier. Treatment approaches vary depending on severity and underlying cause. Some people require oral supplementation. Others may require injections if absorption is significantly impaired, and underlying causes still need to be understood properly. That's why individualized medical care matters. Now, I want to talk briefly about emotional health because this is another area where deficiency can quietly affect quality of life. People living with chronic fatigue and neurological symptoms often begin feeling emotionally overwhelmed. They become frustrated, discouraged, anxious, less socially active, less physically active, and sometimes they start losing confidence in themselves because they no longer feel mentally or physically sharp. I've seen this happen many times. And honestly, sometimes simply identifying the underlying issue brings enormous emotional relief. Not because everything suddenly becomes perfect overnight, but because people finally understand this wasn't all in my head. Now, here's the part I really want you to remember today. Fatigue is common. Dizziness is common. Weakness is common. But common does not automatically mean normal, especially when symptoms are persistent, worsening, or interfering with daily life. And vitamin B12 deficiency is one of the many reasons doctors try to look deeper when those symptoms continue. Because sometimes the body is not simply aging, sometimes it's struggling quietly underneath the surface. And honestly, that distinction matters far more than most people realize. So here's the final takeaway. If you've been feeling persistently exhausted, mentally foggy, dizzy, weak, unsteady, or simply unlike yourself for a long period of time, don't panic, but don't ignore it either. Talk with a qualified medical professional, look at the full picture, review medications, review nutrition, review lab work, review symptoms carefully, because sometimes the body gives subtle warning signs long before major problems appear. And learning how to recognize those signals calmly may protect both your physical health and your quality of life for years to come.